Hey everyone, this video is going to focus on mental health medications. The use of mental health medications is becoming more prevalent, which makes it likely that you or someone you know is taking or has taken these meds. Having a basic knowledge about these medications allows trip leaders and first aid providers to better support people taking these medications while in remote environments. In this video, I'm going to provide an overview of mental health medications and give information about what questions to ask during a patient assessment of a person taking these medications. This will include common medications related to mental health diagnoses, side effects which can accompany these meds, and considerations for trip leaders and members of an outdoor trip. An important note about this video is that it is not intended as a replacement for consultation with your doctor. Please contact your doctor if you do have questions about your medication. I want to start by providing some background information which is important to know when discussing mental health meds. First, a psychiatrist is a doctor who specializes in the diagnosis and treatment of mental illness. People often use their general practitioner for management of mild conditions. However, when it comes to more complicated cases, it is typically more appropriate to seek care from a medical professional who specializes in assessment and management of mental health conditions. For example, someone experiencing some mild anxiety or depression may talk about it with their general doctor versus a person experiencing severe mood swings or suicidal thoughts. Seeing a general practitioner is often the first step to gain a referral to a psychiatrist, as they would with any other specialist. It's also important to note that there are two different categories for taking medications: maintenance and PRNs. Maintenance refers to medication taken regularly and most often daily. PRN, which means pro re nata, Latin for as the circumstances arise, is used when the patient doesn't need to take the medication consistently, but can use it on an as-needed basis. You may hear PRN or as-needed med used interchangeably. There are a few common mental health medications that are used as PRNs, which I will point out throughout this video. Be aware with PRNs, some of them work very quickly while others are slower acting. Whether we are talking about PRNs or maintenance medication, timing is extremely important. With PRNs, the timing is going to be focused more on how long you need to wait between doses. It's easy for someone in a moment of crisis to want to take more because they're not experiencing immediate relief. Make sure you're following the directions of the prescription bottle, which will specify how often the PRN can be taken. For maintenance meds, timing comes down to being consistent with the time of day you are taking your meds. The point of taking maintenance medications is to introduce the med into your system and to maintain the same effective level of the drug within your system. Not all general medications are strict about this, but when it comes to mental health medications, consistency and timing is key to maintaining stability. Just because someone is taking their medication daily as prescribed does not mean they're taking it correctly. Changing the timing of the doses can bring back unwanted symptoms because we're bringing the dose of the medication within our body up and down, which lowers the effectiveness and is very dangerous. It may take up to 6 weeks or more after a medication change to fully stabilize within your body. The idea behind why it may take so long is because these meds work to alter multiple areas within our body, and it takes time to notice these changes. It can be really tough for someone experiencing difficult symptoms to be patient during this time. If you are in a position of support with someone going through this, validate how difficult it is. Practice any helpful coping skills with them, and remind them that it takes time for the medications to balance in their body. If they don't have a scheduled follow-up appointment with their doctor within a few weeks after medication change, make sure they're signed up for one to check in. When stopping these medications, withdrawal symptoms, which can range from mild to severe, may start within 5 days of stopping the med and continue for weeks. The term tapering off refers to slowly easing off a medication instead of stopping it immediately. Tapering off your medications can lessen or take away any withdrawal symptoms. Especially when it comes to mental health medications, someone should never stop taking their meds without first talking to their medical professional. It is common for people to start on a medication and feel relief from their symptoms after a few weeks and decide they are cured and don't need the med anymore. Unfortunately, this can lead to severe withdrawal symptoms, including suicidal thoughts. There are 5 types of psychotropic medications or medications used to treat mental health disorders. There are antidepressants, anti-anxiety, stimulants, antipsychotics, and mood stabilizers. Some people may only be using medication from one of these categories, while others dealing with more severe mental illness may take multiple. Individuals with depression disorders, such as major depressive disorder, most commonly take antidepressant medications. A common type of antidepressant is SSRIs, or selective serotonin reuptake inhibitors. These meds are focused on increasing the amount of serotonin in your brain, which helps with regulating your mood and sleep habits. Some of the more common SSRIs are Celexa, Lexapro, Prozac, and Zoloft. Side effects of taking these medications can include drowsiness, weight gain, sexual problems, or dry mouth. Anti-anxiety medications are used to treat many types of anxiety disorders, such as generalized anxiety disorder, specific phobias, social anxiety disorder, and panic attacks. Depending on the type of anxiety being treated, the medication could be as minimal as a PRN for higher anxiety situations or a maintenance med taken daily. Some of the SSRIs used for depression disorders are also utilized with anxiety disorders, such as Celexa. Beta blockers are a medication created to treat high blood pressure, but were found to be helpful with treating anxiety. Beta blockers work by treating the physical symptoms that come with anxiety, such as increased heart rate, sweating, and trembling. The idea behind this use is to break up the cycle of anxiety by taking away the physical symptoms, which tend to elevate our anxiety even more. A common beta blocker used as a PRN with anxiety is propranolol. It also carries the nickname of the public speaking drug because of its ability to help you manage the typical physical symptoms associated with public speaking. While propranolol can be very helpful within these types of situations, a downfall is that it takes 30 to 60 minutes typically for it to start working. Unlike other PRNs, which work quickly, propranolol is one that works best for more planned events. This could be giving a speech or high-impact backcountry activity, such as climbing or whitewater rafting. Something important to note about beta blockers, especially if you are a guide doing any type of strenuous activity with your clients, is that they're designed to slow down your heart rate and should not be used while engaging in exercise. This could cause their blood pressure to drop alarmingly low and result in fainting. Another PRN used for anxiety is the antihistamine hydroxyzine. This med tends to act quicker than propranolol, but a common side effect is fatigue. Other side effects of anti-anxiety meds can be nightmares, headaches, and nausea. Another type of medication used for anxiety is called benzodiazepines, or commonly known as benzos. Benzos are mild tranquilizers and work by slowing down messages between the brain and the body. Common benzos include Xanax, Valium, Ativan, and Klonopin. And common side effects of taking these meds include sedation, dizziness, and headache. Some of these types of medications can be very effective as PRNs for panic attacks due to their fast-acting and calming effect. Although benzos typically work very well, medical professionals tend to hesitate when prescribing them due to how quickly they create physical dependence and the difficulty people have with withdrawal symptoms. The withdrawal from benzos can result in rebound anxiety, which means your anxiety worsens for a period of time while coming off the medication. You may also experience panic attacks, insomnia, tremors, excessive sweating, and nausea. Tapering off of benzos should only be done under medical professional supervision and very slowly. Medications classified as stimulants are used to treat diagnoses such as attention deficit hyperactivity disorder, or ADHD, which tends to come with symptoms such as difficulty concentrating, focusing, and staying organized. Stimulants are believed to work by increasing dopamine levels within the brain, which is shown to increase concentration and decrease hyperactivity and impulse behaviors. Some medications you may have heard of within this category are Adderall and Ritalin. While these meds are helpful at slowing down those with true ADHD, they tend to do the exact opposite effect for someone without ADHD. This is why they have become more and more popular to abuse within the teen and college-age populations because of their ability to help people lose weight and stay up for days without sleep. Decreased appetite, insomnia, and weight loss can be side effects for those with ADHD as well. Antipsychotic medications are used to address mental health diagnoses, which includes psychosis. Possible diagnoses could be schizophrenia, major depressive disorder with psychosis, or bipolar disorder with psychosis. While psychosis can take many different forms, the person will experience some separation from reality, which is accompanied by some combination of delusions and hallucinations. In layman's terms, antipsychotics work by altering chemicals in the brain, such as dopamine, to reduce psychotic symptoms. These meds don't cure psychosis, and the symptoms will most likely return if the person goes off their antipsychotic. Some common side effects of taking antipsychotics are drowsiness, increased appetite, and weight gain. Antipsychotics are typically used as daily maintenance medications to help keep the individual stable. There are, however, times where a prescriber may add in an antipsychotic as a PRN for more acute psychosis, or possibly when first introducing this med to the person and wanting to see its effectiveness. The last category of psychotropic medications is mood stabilizers. These types of medications are used to treat extreme moods, such as someone with the diagnosis of bipolar disorder. This disorder includes extreme elevated moods, also known as mania, and extreme low depressive moods. Just as with antipsychotic meds, mood stabilizers work to normalize the chemicals in the brain that are known to impact the mood. Some common mood stabilizers are Lamictal, Depakote, and lithium. These meds can have difficult side effects such as upset stomach, weight gain, dizziness, and confusion. With mood stabilizers, a common indicator it is working correctly is to have less mood swings. Although this is the goal, someone whose normal experience is to have these extreme mood swings may really struggle with feeling a lack of emotion. With people diagnosed with bipolar disorder, I commonly hear them talk about missing the experience of mania. Although their mania may have been destructive at times, it also allowed them to be very productive. For example, clean their entire house and avoid sleeping. Due to this, people with these diagnoses may be more likely to stop taking their meds. As I mentioned before, someone may be taking several medications from these different categories, and some medications overlap in their uses. There are a few important things to note when taking someone who uses these meds out in the backcountry. First, if you are working as staff or a guide for the trip, have an in-depth conversation with the person prior to leaving. Ask them how long they have been on the medication, what the medications are used for, and if they are maintenance or PRNs. Since everyone can be different, ask about what they experience as side effects with the meds and what could happen if the person forgets to take it. Talk about the timing of their doses. Some people may have to take meds in the middle of the day, so find out what time their doses need to take place and help remind them. Make sure they're setting alarms on their phones or watches. As we all know, our schedule changes drastically out in the backcountry, which can throw us off and make us miss medication doses. Even if the person is taking their medications correctly while out, being in a completely different setting could change the symptoms of their condition. If an increase to symptoms happens, do your best to keep the person calm and make the decision to stay or leave the field based on your current situation and the safety of the entire group. On a backcountry trip, medication storage will look different than at home. While working as a guide for an at-risk adolescent wilderness program, we would carry all medications in a locked, waterproof case. This is to ensure no medications was lost, stolen, or damaged. Prior to giving out medication, we would ask the person to state their name and date of birth. We would then double-check this on their chart and the medication bottles prior to having the person take the med. We would also do a daily inventory of the meds to make sure there weren't any missing. Unfortunately, someone stealing medications can happen. Someone taking another person's medication could experience a multitude of potentially life-threatening symptoms, including seizures, nausea, confusion, and allergic reaction. Consider the possibility of misuse of medication if someone on the trip experiences new symptoms that are not linked to a known cause. Depending on the trip you are going on, it may also be necessary to double-check the medications in the bottles are correct. There are websites, apps, and books that all provide pill identification based on color, shape, and markings. This would happen during the intake process prior to starting the trip and would be checked throughout the trip. Depending on the type of trip you are on, your medication storage and distribution may look completely different than what I just described. However, when it comes to medication storage, you need to think waterproof. A container that will keep the meds from getting damaged and not exposing the meds to extreme temperatures, which may lessen their effectiveness. I hope this video has been helpful in giving you more insight into the world of psychotropic medications. As with all medications, each person can be affected differently, so make sure to talk to that individual about their own experience. Staying informed on mental health topics not only helps create safety within the backcountry, it can shine an important spotlight on stigmas which keep many people with mental health issues out of the woods. We all deserve to experience the benefits of the natural world. Thank you for watching.